leaving no one behind. Every child needs to be immunized. We're proud to have with us the director of the country program for Gavi, the Global Alliance on Vaccines. Welcome, Dr. Khatib.
Thank you very much for hosting me.
You've been in the field for a long time.
That's right.
And we've seen the countries, according to emergencies, according to what's happening in the world, sometimes the vaccination coverage goes up and sometimes it wanes. Where do we stand now?
Globally, according to the latest report that was put out by WHO and UNICEF, it shows that vaccine coverage has plateaued. And usually when you reach 80% of coverage as an average across the world, the job becomes much harder really to reach that child and leaving no one behind.
The last 20%.
Yeah, exactly. The last mile is usually the toughest to reach because you're entering into areas where it's not just about providing service. You're entering areas where you have to think about those populations that have forgotten or neglected.
Or hard to reach also.
Hard to reach. Those that do not have the infrastructure around them. You're entering into some religious beliefs. You're entering into policies in countries about how do you reach internally displaced and refugees. So it's obviously much harder and requires specific strategies.
When you have displaced populations or refugees, in a way, doesn't it make it a little bit easier because they're circumscribed in one area and we go to them? I mean,
it should be. Except, within Gavi Alliance, we have to work with governments because vaccines are not just delivered like this.
Absolutely.
You really need to have the infrastructure. So you need to have the government that's hosting those internally displaced to agree to reach them. Otherwise, you cannot reach them.
When you talk about infrastructure, as far as I remember, that immunization has actually led to building health systems in many countries because that's how the primary health care really grew with the immunization program. If you were given a chance to give a call now, what would you tell the countries that are lagging behind, such as where we're having problems like Pakistan, Afghanistan, where else?
In the region, I think we have approximately 2.3 million children that are under-immunized. And those under-immunized children are mainly in Afghanistan, Pakistan, Sudan, Somalia, and Djibouti. And obviously, you have to think about the infrastructure. You have to think about the human workforce. You have to think about the political commitment of the country, and then what is needed for us to reach. And my plea for the countries is really to look closely at what are the barriers and try to adopt their strategies accordingly. And I think from an alliance point of view, and I just don't speak about Gavi Secretariat, but equally about WHO, UNICEF, and the World Bank in the region, wherever they're present, is that we're there to help them reach those children.
Okay. And we've been hearing in this regional committee now that we're back to primary health care very much, and we're calling for primary health care to take precedence. So we're calling on all governments to ask for the assistance needed because we really need to leave no one behind.
That's right. And it requires strong political commitment that's translated in domestic resources. And that's translated in policies and understanding of the context.
Will.
Yeah, that's it. Political will, political commitment, domestic resources, and a bit of energy behind it. Because I think in vaccines, we've lost that energy a little bit.
Because there have been so many other priorities.
That's
whereas
right.
This is
That's right.
the foundation, I would say.
That's right. That's right. I think in a humanitarian response, people forget that vaccines actually is critical. Prevent so many outbreaks. And we see in Yemen, you have a diphtheria outbreak, you have a cholera outbreak, you have a measles outbreak, and it just
part of the emergencies that we need to tackle.
To make sure that we stop those outbreaks.
Okay. Remember, health for all, by all. Vaccinate everybody and leave no one behind.
Exactly. Thank you.
Thank you.